In this video, we're going to talk about acute cholecystitis. This is an overview and introduction. So acute cholecystitis is inflammation of the gallbladder, and it's usually because of obstruction of the cystic duct by gallstones. Acute cholecystitis is the most common complication of cholelithiasis, which is formation of gallstones in the gallbladder. Just to be clear, cholelithiasis is formation of stones in the gallbladder, which can lead to a few complications, one of which is acute cholecystitis. The other terminology, cholelithiasis, is formation of stones, gallstones, in the common bile duct. But we will not focus on that here. In this video, we will mainly focus on acute cholecystitis, but really, we will also talk about every other complication, and hopefully we can get our head around it together. So here is a guy with right upper quadrant pain of the abdomen. Let's look at the normal anatomy of the upper GIT partly. So here is the gallbladder. Now the gallbladder is an organ that stores what's called bile, and bile is a mixture of cholesterol and other pigments. The bile is important in digesting fatty foods. The bile is actually produced by the liver, and gallbladder just stores the excess bile. So back to the anatomy. Here is the gallbladder, the body, the neck, and the fundus of the gallbladder. This is the cystic duct coming out from the gallbladder and connects to the common hepatic ducts, which arise from the liver. The joining of the cystic duct and common hepatic ducts forms the common bile duct, which runs all the way down and joins with the pancreatic duct from the pancreas. Before moving to the pancreas, the stomach actually continues on to the small intestine here, transporting the half-digested food content. The first part of the small intestine is the duodenum. Then the duodenum goes on to the jejunum, which is the second part. Here is the pancreatic duct I was talking about, and here is part of the pancreas. And essentially, the gallbladder will contract and release bile, or the liver will release bile, which will go down and end up in the common bile duct. The common bile duct runs all the way down and joins with the pancreatic duct from the pancreas. The newly formed duct will then release this bile and the enzymes from the pancreas into the duodenum through the ampulla of Vata to help digest food. In acute cholecystitis, a gallstone, which was formed in the gallbladder, gets stuck in the cystic duct. Now, a lot of us actually have gallstones in our gallbladders, but they don't cause any problems. We are asymptomatic. Sometimes people get unlucky and the gallstones get stuck either temporarily or for some time. There are many types of gallstones, but we won't talk about that here. Just think of gallstones as a mixture of cholesterol and other pigments within bile. So when the gallstones get stuck in the cystic duct, the gallbladder will try to contract and push it out without any success. And this obstruction results in inflammation to the gallbladder, and this is acute cholecystitis. Acute cholecystitis shares similar features to two other conditions called biliary colic and cholangitis. But these three conditions do differ. We won't talk about them now, but they differ in the pain, having fever or increased white cell count, and finally jaundice, which is yellowing of the skin. So what are actually these conditions? Well, biliary colic is where there is only temporary obstruction of the gallstone at the neck of the gallbladder. So it can go